Hello, this is Mrs. Ignacio going over some mental health questions. So, once we go over the question, we'll also talk about the rationale. Pause the video at any time to give yourself some time to think through these questions. So, here's question number one. A nurse is caring for an adult client who says he is experiencing increased anxiety and an inability to concentrate. Which of the following responses should the nurse make? It sounds like you're having a difficult time. Have you talked to your parents about this yet? Why do you think you're so anxious? How long has this been going on? Take some time, pause the video, and get your answer. Okay, let's start from the bottom. We're going to work our way up from choice D. Okay, actually, first, let's take a look at the question. Let's break down the question and ask ourselves, what is the question asking us? This is a young adult client, so it doesn't matter if they're young or old, but this is an adult client. So they don't need to get their parents' permission for anything because they are an adult. So he is experiencing increased anxiety and an inability to concentrate. Which of the following responses should the nurse make? Also saying which response is the most therapeutic. So D, how long has this been going on? Well, this is actually a non-therapeutic response. It is a close-ended statement, and it doesn't encourage the client to talk because a client can say 6 months, 2 weeks, and that is it. They're answering your question, but you're not getting any more details. C says, why do you think you are so anxious? This is also non-therapeutic. You will learn that you never choose the answer that says why. Okay, that's not going to be the correct answer. When we ask our patients why, it places them on the defensive. C is also non-therapeutic because it can make that client feel defensive and they may not be able to tell the nurse why. Okay, B is not correct. Have you talked to your parents about this yet? Because this is non-therapeutic and this is an adult. Even though the fact that he's a young adult, but he's an adult, he doesn't have to talk to his parents. Okay, we do not address the parents in this because it's always about the patient, and this patient is an adult, doesn't need to address the parents. But A is the correct answer because it is the most therapeutic. It sounds like you're having a difficult time. This response is open-ended, it's empathetic, and encourages the client to talk. And that's what you want. When you establish that nurse-patient relationship, you want the patient to be able to talk to you. All right, let's go to question number 2. A nurse is admitting a client who has experienced a weight loss of 11 kilograms, which is 25 pounds, in the past 3 months. The client weighs 40 kilograms or 88 pounds and believes she is fat. Which of the following aspects of care should the nurse consider the first priority for this client? Well, we have choice A, identify the client's nutritional status. We have choice B, request a mental health consult. C, plan a therapeutic diet for the client. Or D, provide a structured environment for the client. Take a moment, pause the video, and come up with your best answer. Okay, well, let's describe our patient, and I would challenge you to think of every question as a patient that you are caring for. So this patient has lost a tremendous amount of weight or a significant amount of weight, 25 pounds in the past 3 months. And so they weigh 88 pounds and believe that they are fat. So this is quite concerning. Whenever we have a patient that has had, a lot of weight loss, we're concerned about their nutritional status. We are looking at lab values like albumin. We're looking at fluid electrolytes to see if they are healthy. So let's take a look at the choices, and I'll start from D. Provide a structured environment for the patient. Well, it is not a problem to provide a structured environment and to monitor when they're eating, but this is a priority question. Think about it, if you could do one thing and you had to go home, what would it be? So providing the structured environment is not the most important thing to do for this patient. When we think about priority, think about Maslow's hierarchy. Let's look at C. Plan a therapeutic diet for the client. So this is not going to be the correct answer choice either, because planning a therapeutic diet for the client will be necessary, but something else is more important. Okay, again, this is a priority question. If you could do one thing and you had to go home. B, request a mental health consult. Is this necessary? Probably, but is this a priority? Remember Maslow's hierarchy. Okay, let's look at A. Identify the client's nutritional status. This is the correct answer. And according to the nursing process, the nurse should perform an assessment first. They gather data. Remember ADPI. So we need to find out what the nutritional status is, and then we can go through with the diagnosis, the planning, intervention or implementation, and then evaluating the care. So the assessment identifies the client's nutritional needs as well as complications the client might be experiencing related to the eating disorder. Again, we're concerned about protein, that's albumin levels. We're concerned about fluid electrolyte imbalance with this patient. Okay, let's go to question 3. A nurse is caring for a client who has severe manifestations of schizophrenia and is medicated PRN as required, as necessary for agitation with haloperidol. The nurse should assess the client for which of the following adverse effects. Take a moment and think about what you think the correct answer choice is. Is it dysrhythmias, cataracts, pancreatitis, or bleeding? Pause the video and choose your answer. All right, so what is this question asking? Well, we have a schizophrenic patient who has severe manifestations. And we know with schizophrenia, the patient can have hallucinations through the 5 senses. So auditory, gustatory, tactile, okay, visual, and what was the other one? Auditory, visual, tactile, and olfactory. That was the 5th one that I missed. So through all of the 5 senses, the patient can have these kinds of hallucinations. So we would medicate them, PRN for agitation, and the medication is haloperidol. This is a question asking whether or not do you know about haloperidol. This medication is worth looking up and understanding because it is a frequently seen medication for NCLEX. So let's start from D. Bleeding. So that's not one of the effects or potential adverse effects for haloperidol. So D is not correct. Pancreatitis. The client who takes haloperidol is at risk for hepatitis, but pancreatitis is not an adverse effect. So C is not correct. And I should be actually crossing these out as we go. Okay, so B, cataracts. This is not correct because the patient who takes haloperidol is actually at risk for glaucoma, but cataracts are not an adverse effect. So by the process of elimination, choice A is going to be correct. Cardiac dysrhythmias are a risk for clients taking haloperidol and other conventional antipsychotic medications. The client should be monitored for changes in vital signs, tachycardia, and EKG changes, including prolonged QT interval while taking haloperidol. There is not a risk for cardiac arrest. Oh, I'm sorry, there is a risk. I'm sorry. There is a risk for cardiac arrest due to torsades de pointes. And that is a significant rhythm that is not compatible with life. Okay, torsades de pointes. Okay, okay, all right. Let's go to question 4. A nurse on a mental health unit is caring for a client who has generalized anxiety disorder. The client received a telephone call that was upsetting, and now the client is pacing up and down the corridors of the unit. Which of the following actions should the nurse take? Instruct the client to sit down and stop pacing. Allow the client to pace alone until they're physically tired. Have a staff member escort the client to her room. Walk with the client at a gradually slower pace. Take a minute, think about this question, and then choose your answer. Okay, so what's going on with this patient? Well, they have generalized anxiety disorder and they are upset because they just got off the phone with a conversation that was not pleasant for them. Now they're displaying behaviors that they're getting increasingly agitated. Pacing is one of those red flags. What should the nurse do noticing that a patient that has anxiety is starting to escalate? Well, the role of the nurse is to keep the patient safe, recognize those clinical cues that they're increasing their agitation, and get the patient down, right, as far as de-escalating their anxiety. So what will do that? And I'll start with A this time, instruct the client to sit down and stop pacing. Well, if you have a patient that has moderate to severe anxiety, they are not going to be able to follow instructions that well, okay? So the client is experiencing severe kind of panic and they may not be able to comprehend and follow commands. That's one of the things you must know about patients that have this kind of severe anxiety, okay? So A is not the correct answer choice. Okay, instruct the client to sit down. Okay, and stop pacing. That's not correct. B, allow the client to pace alone until physically tired. Well, this patient is pretty much in crisis. You never leave a patient that's in crisis alone, and crisis can look like many different things. This is not the correct answer because the nurse notices these cues and it's the nurse's responsibility to intervene. NCLEX is going to test you on, are you a safe nurse? If you see something going on with the patient, are you just going to walk away and go to lunch? Or are you going to do something? Okay, so the nurse in this case should take measures to reduce the client's anxiety. Medicating the patient may be one of the things that you can do, or let's look at one of the other choices that are left. B, have a staff member escort the client to their room. Okay, again, we don't want to leave this patient alone, right? This patient is in crisis. We never leave patients that are in crisis alone. This patient's behavior is escalating. We're concerned about their safety. So yes, D is the correct answer because we are staying with the patient and we are walking at a slower pace. So it's important for us to maintain a calm atmosphere and we're gradually decreasing the pace. And so we're allowing them to have gross motor activity, and that's going to help them to kind of relieve their anxiety and will help calm them down. And this is also a therapeutic offering of yourself because you are staying with the patient and you are walking with the patient, but at the same time, you're slowing the pace down, and that will help decrease their anxiety. Okay. All right, let's go to question 5. A nurse is caring for a client who was involved in heavy combat and observed 4 casualties. The nurse should suspect that a client is suffering from post-traumatic stress disorder if the client makes which of the following statements. Okay, I check my room because I check any room I enter because the enemy is still after me and could be hiding anywhere. Or B, my child was born with a birth defect due to exposure I had overseas. Or C, I killed 4 enemy soldiers with my bare hands and saved my entire battalion. D, in my dreams, all I can see are the wounded reaching out and trying to grab me. All right, take a moment, pause the video, and select your answer. Okay, let's look at this question and see what is going on with our patient because each question is a patient. So I see a patient that has had combat time, heavy combat, and they have seen the casualties of war, which can be actually quite horrific. So I suspect this patient is suffering from PTSD if they say which of these comments. So let's start with A. I check my room, or I check any room I enter because the enemy is still after me and could be hiding anywhere. So this is more like a paranoia. So that statement is more like a paranoid statement, not necessarily PTSD. Remember, PTSD, the patient has flashbacks, recurrent nightmares, which may affect their sleep pattern. They have hypervigilance, emotional numbing. And so that statement doesn't fall in line with those characteristics of PTSD. So A is not correct. B, my child was born with birth defect due to an exposure I had overseas. So this statement is a statement of guilt, not necessarily PTSD. So it's not correct. C, I killed 4 enemy soldiers with my bare hands and saved my entire battalion. So this is a quite remarkable feat, but this is more like grandiosity. This is not necessarily PTSD. So this statement is really saying things that, okay, I am so great. I am the greatest of all times. I can kill people with my bare hands, saving the entire battalion. So that is more like grandiosity. It could even be someone that's in the manic phase of bipolar disorder. So D says, in my dreams, all I can see are the wounded reaching out and trying to grab me. And this is definitely in line with PTSD because many patients who have PTSD repeatedly re-experience the ordeal in the form of flashback episodes, memories, nightmares, or frightening thoughts, especially when they're exposed to events or objects reminiscent of the trauma. This patient's statement about haunting dreams is typical of a patient who has PTSD. All right, let's go to question 6. Okay. A school nurse is talking to a 13-year-old female at her annual health screening visit. Which of the following comments made by the adolescent should be the nurse's priority to address? A, my parents treat me like a baby sometimes. B, I haven't gotten my period yet, and all my friends have theirs. C, none of the kids at school like me, and I don't like them either. D, there's a big pimple on my face, and I worry that everyone will notice it. Okay, take a moment, pause the video, and come up with your best answer. Okay, so let's look at this patient, 13-year-old female, and she is at her annual health screening visit. Think about what's appropriate in accordance with Erik Erikson's stages of development. What is appropriate for a 13-year-old? Well, we know that their friends are very important to them. They're self-conscious as their bodies are changing. They're going through puberty, right? So let's see. When we think about this, it is priority, which is the most important thing for us to address with our patient. If we had to address one thing and then we had to leave, what would that one thing be? So A, my parents treat me like a baby sometimes. Well, that's common. That's normal for a 13-year-old to feel that way because they're trying to grow up and their parents are, probably still treating them as a young person, younger than what they are or younger than they feel that they are. So this is something to further explore, but it's not necessarily a priority. It's not the most important thing. So I'll cross that out. Okay, I haven't gotten my period yet, and all my friends have theirs. So there is a wide variation amongst the development with adolescents. Some children may get their menstrual cycles onset at as early as age 8. Some can even get it as late as age 16. So this individual may just be a late bloomer, but this is not necessarily a priority. Okay, so B is not correct. None of the kids at this school like me, and I don't like them either. This is a very concerning statement, okay? This tells me that this patient, this 13-year-old patient, is potentially at risk for depression. They may be at risk for an eating disorder or self-harm and even harming others. So this is a priority to address, okay? A priority to address. Let's look at D. There's a big pimple on my face and I worry that everyone will notice it. Well, that's a common thing that adolescents face, teenagers face. We can further explore it, but it's not necessarily a priority at this time. So the correct answer is C. I'm concerned that none of these kids like her and she doesn't like them either. So this could be very ominous. Okay, let's look at question number 7. A nurse on a long-term care unit is creating a plan of care for a client who has Alzheimer's disease. Which of the following interventions should the nurse include in the plan? A, rotate assignment of daily caregivers. B, provide an activity schedule that changes from day to day. C, limit time for the client to perform activities. D, talk the client through tasks one step at a time. Take a moment, pause the video, and select your answer. Okay, so let's look at these answer choices while we're working with our patient that has Alzheimer's disease. Remember, this patient may have plaques and tangles that first attack the short-term memory, okay? So A, rotate assignment of daily caregivers. That is actually a bad idea. You don't want to do that with your patient with Alzheimer's because their short-term memory is compromised. In actuality, the nurse should assign the same staff whenever possible to care for the client to minimize confusion and to ensure continuity of care for the patient. Okay, so A is not correct. B, provide an activity schedule that changes from day to day. Well, this answer B is similar to answer A, and it's not correct. Okay, so we don't want to keep changing things around. We want to provide a structured schedule that does not change from day to day, again, to help decrease the patient's confusion. C, limit time for the client to perform activities. Well, no, we don't want to limit their time. We want to give enough time, provide plenty of time for the patient to perform activities to help increase their comfort and decrease the client's anxiety level. So C is not correct. D is the correct answer. Talk the client through tasks one step at a time. The nurse should plan to talk the client through tasks one step at a time to help minimize their confusion and to promote their independence. And this can help to decrease the patient's anxiety level. Okay, let's go to question number 8. Okay, so this is a good one. This is lithium, a big NCLEX concept that you have to understand, lithium toxicity. So a nurse is providing discharge teaching to a client who has bipolar disorder, which is a mood disorder, and will be discharged with a prescription for lithium. The nurse should teach the client that which of the following factors put her at risk for lithium, lithium toxicity. A, the client runs 4 miles outdoors every afternoon. The client drinks 2 liters of liquids daily. B, the client eats 2 to 3 grams of sodium-containing foods daily. D, the client eats foods high in tyramine. Okay, so take a moment, pause the video, and come up with your best answer. Okay, so let's start at the bottom this time. So the client eats food high in tyramine. Well, tyramine foods, medications that go with that are contraindicated foods high in tyramine are actually your MAOIs. MAOIs are given for depression, maybe mood disorder, but that's not what we're looking at here. This is lithium. So the patient eating foods high in tyramine, that's not going to be the correct answer. So foods high in tyramine interact with MAOIs, which are really prescribed for depressive disorders, okay? Not necessarily the bipolar. Now, bipolar can have the depressive phase, so technically they could be prescribed an MAOI, but that's not what we're looking at right now because this question is asking about lithium toxicity. Okay, so D is not correct. C, the client eats 2 to 3 grams of sodium-containing foods daily. So that's a lot of sodium, and this does not put the client at risk for lithium toxicity, though. Okay, if a patient has, if they're taking lithium, they need to have an appropriate level of salt because very low sodium diet prevents normal excretion of lithium from the body and can cause lithium toxicity. A high sodium intake will lead to excretion of lithium and possible drop in the lithium level. So a client should be taught to eat an adequate amount of sodium and not to greatly decrease or increase their sodium intake. So normal sodium intake is what you want to focus on. C is not correct because it's too high. It's above what we want the patient to have. So too little sodium is no good with lithium, and too much sodium is no good, okay, if you think about it in that way. So B, the client drinks 2 liters of liquids daily. That's actually good for her to do, okay, or him to do. So drinking 2 to 3 liters of liquid daily can help prevent lithium toxicity because it promotes the normal excretion of lithium from the body. This choice A is going to be the correct answer. Running 4 miles outdoors every afternoon. Well, this is not safe. Strenuous exercise in outdoor heat can lead to dehydration. Dehydration will place the client at risk for lithium toxicity. Mild to moderate exercise will not lead to lithium toxicity, but if this individual engages in strenuous exercise during hot weather, they should be sure to replace the water and the sodium that have been lost through their profuse sweating. And we know that sweating cools the body through evaporative cooling, releases extra fluid and extra salts, right? This also applies to other factors that can cause the patient to become dehydrated, such as having diarrhea or taking diuretics. So if your lithium patient has diarrhea, they're taking diuretics, I am concerned about them going into lithium toxicity. Remember, 0.6 to 1.2 is the therapeutic range for lithium. 1.5 and above tells me the patient has lithium toxicity. Okay, so far, hopefully you're doing fantastic. We have 2 more questions. So question number 9. A nurse is providing teaching for a patient who has binge eating disorder and is morbidly obese. The patient has been prescribed orlistat. Which of the following statements indicates to the nurse that the patient understands the teaching? A, I will take my dose of orlistat every morning an hour before breakfast. B, I will eat a no-fat diet to prevent side effects from the medication. C, I will stop taking orlistat and call my doctor if my urine gets darker in color. D, I will feel less hungry during meals while I am taking orlistat. Okay, so this is a question that is a positive question. We want the patient to say this because it shows that they understand the side effects of the medication, or they understand their condition, they understand how the medication is working or not working. Take a minute to pause the video and select your very best answer. Okay, so A, I will take my dose of orlistat every morning an hour before breakfast. So this is not correct. This medication, orlistat, is a lipase inhibitor, and it should be taken 3 times a day during or within an hour after the meal. Not before, but after. So it's best to take it with the meal. So taking it an hour before the meal is not going to be the correct choice. So A is not correct. B, I will eat a no-fat diet to prevent side effects from the medication. This is not correct. Everyone needs fat in their diet. That we need the good fats, right? Like the omega-3s that are found in olive oil and salmon, right? But consuming too little fat may leave the client not getting enough nutrients, okay, especially from fat-soluble vitamins. So this patient should have a well-balanced diet, low-calorie, nutritious diet, and 30% of the calories should be fat calories, and that should be from good fats, okay, like your omega-3s, okay? So B is not correct. C, I will stop taking orlistat and call my doctor if my urine gets darker in color. That is actually the correct answer choice because our orlistat can cause severe liver damage. Therefore, the client should be taught manifestations of liver damage like darker colored urine, right? Light colored stools, jaundice, anorexia, vomiting, and fatigue. Okay, let's look at 4. I will feel less hungry during meals while I'm taking orlistat. Well, this is not true because orlistat is not an appetite suppressant. So let's look at question 10, our last question. A nurse is caring for a client who has major depressive disorder and was prescribed citalopram 2 weeks ago with a planned dosage increase 1 week ago. The client reports having an improved appetite, but still feels very depressed and is still having trouble sleeping. Which of the following actions should the nurse take? A, speak to the provider providing about adding an MAOI to the current medication regimen. B, explain that antidepressants often take several weeks to be fully effective. Tell the client that the provider will need to change citalopram to a different medication. Or B, recommend a sleep study be done on the client. Okay, so what's going on with this patient? They have major depressive disorder. They received this medication to help them with this. Okay, so the patient has improved appetite, but they still feel depressed and they have difficulty sleeping. Okay, so what should the nurse do about it? Well, A says speak to the provider about adding an MAOI to the current medication regimen. So this is not going to be the right answer, okay? So let me cross that out. A is not correct because giving an SSRI along with an MAOI is contraindicated because there is an increased risk for serotonin syndrome. So A is not correct. B, explain that antidepressants often take several weeks to be fully effective. And that's actually true. Okay, SSRIs, along with certain anticonvulsant medications in the treatment of bipolar disorder, okay, it can take 4 to 6 weeks before therapeutic levels are found, okay? So B is the correct answer. Let's look at the others and determine why they're not correct. C, tell the client that the provider will need to change the citalopram to a different medication. It would be appropriate for the nurse to tell the client that citalopram needs to be changed to a different prescription. The nurse should teach the patient about the expected effects of citalopram. Okay, so that's not correct. D, recommend a sleep study to be done on the client. Well, recommending a sleep study is not appropriate at this time until therapeutic effects of the medication are known. So the nurse should teach the client about expected effects or side effects of citalopram. Okay, so that will not be correct. All right, you have been fantastic. We've just reviewed 10 questions for mental health practice. Remember to always think like a nurse.